Good afternoon. My name is Helen, and I'll be your interlocutor today. This test is designed to assess your spoken communication in a healthcare setting.
Before we begin the role plays, I'll ask you a few general questions. Can you tell me your full name, please?
Good afternoon. My name is Daniel.
Thank you, Daniel. What is your healthcare profession?
I'm a registered nurse currently working in a medical ward
How long have you been working as a nurse?
for just over 3 years now, mainly in acute care and outpatient settings.
Thank you. We'll now move on to the role plays. You are the nurse caring for Mr. James Carter, aged 52. He has recently been diagnosed with type 2 diabetes and appears overwhelmed. Your task is to explain the diagnosis in simple terms, address his concerns about lifestyle changes, reassure him, and encourage questions. Let's begin.
Good afternoon, Mr. Carter. My name is Daniel, and I'm one of the nurses looking after you today. How are you feeling at the moment?
Honestly, a bit shocked. I wasn't expecting this diagnosis at all.
That's completely understandable. Getting news like this can feel overwhelming. If it's alright with you, I'd like to explain what the diagnosis means, and then we can talk through your concerns one by one.
Okay.
So, type 2 diabetes means that your body isn't using insulin as effectively as it should. Insulin helps control your blood sugar levels. Over time, those levels can become higher than normal, which is why we monitor and manage it carefully.
Does this mean I won't be able to work anymore?
In most cases, people with type 2 diabetes continue working as normal. With the right management, such as healthy eating, regular activity, and sometimes medication, it's very possible to live a full and active life.
Will I have to take medication forever?
Not necessarily. Some people manage their diabetes through lifestyle changes alone, especially in the early stages. Others may need medication, either short term or long term. Your doctor will review this regularly and adjust your care as needed.
I'm worried I'll eat the wrong thing and make it worse.
That's a very common concern. You won't be expected to change everything overnight. A dietitian will support you with practical advice and will focus on balance rather than strict rules. If you'd like, I can also give you some written information to take home.
That would help.
Of course. Before we finish, is there anything else worrying you that we haven't talked about yet?
No. I think that covers it for now.
Alright. Please remember, we're here to support you, and you can always ask questions, no matter how small they feel.
Thank you. That completes the first role play. We'll now move on to the second role play. You'll have a short time to read the role card. You are seeing Mrs. Evelyn Brown, aged 68. She has been advised to attend regular physiotherapy for chronic knee pain, but has not been attending appointments. Your task is to explore why she has not attended, explain the importance of physiotherapy, negotiate a realistic plan she is comfortable with. Role card, patient, interlocutor. Let's begin.
Good morning, Mrs. Brown. Thank you for coming in today. How have you been managing your knee pain recently?
To be honest, I stopped going to physiotherapy. It was painful, and I didn't feel it was helping.
Thank you for telling me that. Many patients feel the same way at first. Would you mind if I ask what part you found most difficult?
The exercises hurt, and getting there is a hassle.
That makes sense. Physiotherapy can feel uncomfortable initially, especially when joints are stiff. However, the goal is to strengthen the muscles around your knee so that pain reduces over time, not increases.
I thought resting it would be better.
Rest is important, but too much rest can actually make stiffness worse. Gentle, guided movement usually leads to better long-term results. That said, the plan should work for you, not against you.
I also struggle with transport.
Thank you for mentioning that. We can look at options such as fewer sessions, home-based exercises, or referral to a closer clinic. Would any of those be more manageable?
Home exercises might be easier.
That's a great starting point. I can arrange for the physiotherapist to adjust your program and show you exercises you can do safely at home. We can then review how you're going in a few weeks.
All right. I could try that.
That sounds like a positive step. Let's work together and adjust the plan as needed.
Thank you, Daniel. That completes the speaking test.